If your lower back feels stiff the moment you get out of bed, you are not alone, and the fix might be simpler than you think. In this video, I'm sharing 7 gentle stretches that can ease lower back pain after 60, each one backed by physical therapists and easy to do at home. By the end, you'll have a simple routine you can start tonight. Stick around, because stretch number 5 is the one almost everyone skips, and it might be the one you need most. So why does lower back pain seem to show up more often after 60? As we age, the discs that cushion our spine naturally lose some water content, making them a little less springy. The muscles and ligaments around the spine can also stiffen if we sit for long periods. Research suggests this is a normal part of aging, not something to fear. The good news is that gentle, regular stretching is one of the simplest ways to keep your back mobile and comfortable. As always, check with your doctor before starting any new stretching routine, especially if you have an existing back condition. Before we dive in, 3 quick safety tips. First, always warm up with a short walk or a few minutes of gentle marching in place. Second, move slowly, never bounce into a stretch. Third, you should feel a gentle pull, never sharp pain, and if something hurts, ease off right away. Every stretch today can be done seated or standing near a sturdy chair or wall for balance. Ready? Let's start with a gentle one and work our way up together. Number 1, the knee to chest stretch. Lie on your back on a firm bed or mat, knees bent, feet flat. Slowly draw one knee up toward your chest, holding it gently behind the thigh, not the knee joint, if that feels more comfortable. Hold for 20 to 30 seconds, breathing slowly, then switch legs. This stretch is associated with easing tension in the lower spine by gently lengthening the muscles along your back. If getting up and down from the floor is difficult, you can do this right in bed. Do both sides once or twice, and remember, this should feel relieving, never like a strain. Number 2, the seated spinal twist. Sit tall in a sturdy chair with both feet flat on the floor. Place your right hand on the outside of your left knee, and your left hand on the back of the chair. Gently twist your torso to the left, looking over your shoulder if that's comfortable. Hold for 15 to 20 seconds, then slowly return to center and switch sides. This gentle rotation can help loosen the muscles along your spine and make it easier to turn and check your blind spot or reach behind you. Keep every movement slow and controlled, never force the twist. Number 3, and this one is a favorite among physical therapists, the seated cat-cow. Sit toward the edge of your chair, hands resting on your knees. As you inhale, gently arch your back, lifting your chest and looking slightly upward. That's the cow position. As you exhale, round your spine, tucking your chin toward your chest, that's the cat position. Move slowly between the two for about 30 seconds, syncing the movement with your breath. This flowing motion is associated with improved spinal flexibility and can even help your posture. But before I show you stretch number 4, I want to mention the one mistake almost everyone makes with stretching in general. We'll cover it in just a few minutes, so keep watching. Number 4, a modified child's pose using a chair or countertop. Stand facing a sturdy table or the back of a couch. Step back slightly, hinge at your hips, and rest your hands on the surface in front of you, letting your back and head relax downward. You should feel a gentle stretch through your lower back and hamstrings. Hold for 20 to 30 seconds, breathing deeply. This position is associated with releasing tension along the entire length of the spine without putting any weight on your knees or wrists, which makes it especially friendly for anyone with joint discomfort. Number 5, and this is the one I mentioned earlier that most people skip, even though therapists consider it one of the most effective. It's called the pelvic tilt. Lie on your back with your knees bent, feet flat on the floor. Gently flatten your lower back against the mat by tightening your stomach muscles and tilting your pelvis slightly upward. Hold for 5 seconds, then release, and repeat 10 times. It looks small, almost too simple, but this tiny movement strengthens the deep core muscles that support your lower back all day long. Research suggests a stronger core is associated with fewer episodes of lower back discomfort as we age. Small movement, big benefit. Number 6, the seated hamstring stretch. Sit at the edge of a sturdy chair, extend one leg out straight with your heel on the floor and toes pointed up. Keeping your back straight, hinge forward slightly from your hips until you feel a gentle stretch along the back of your thigh. Hold for 20 seconds, then switch legs. Tight hamstrings can pull on the pelvis and add extra strain to your lower back, so loosening them often brings surprising relief. Go slowly, and only lean forward as far as feels comfortable. This isn't about touching your toes. And finally, number 7, the seated figure 4 stretch, wonderful for the muscles deep in your hip and lower back. While seated, gently cross one ankle over the opposite knee, forming a figure 4 shape. Sit up tall, and if you'd like a bit more stretch, lean forward slightly from your hips. Hold for 20 to 30 seconds, then switch sides. This stretch targets the piriformis muscle, which sits close to the sciatic nerve, and keeping it flexible is associated with reduced tightness that can radiate into the lower back and hip. If crossing your leg feels uncomfortable on your knee, simply skip this one or ask your doctor for a gentler alternative. Now, here's that common mistake I promised to mention. Many people hold their breath while stretching, which actually makes muscles tense up more, not less. The fix is simple: breathe slowly and steadily through every stretch, in through your nose and out through your mouth. Also, avoid stretching cold muscles first thing in the morning without a short warm-up first. And remember, mild soreness the next day is normal, but sharp or shooting pain is not. That's your cue to stop and check in with your doctor. Let's recap: knee to chest, seated twist, cat-cow, child's pose, pelvic tilts, hamstring stretch, and the figure 4. Here's your action step for tomorrow: pick just 2 of these, maybe the pelvic tilt and the knee to chest, and do them for 5 minutes right after you wake up. Small, consistent movement is what really adds up over time. If this helped, hit subscribe for more senior health tips every week, right here on Health After 60. And if you want to know the 5 foods that could be making your joints feel stiffer, that video is coming up next. You won't want to miss it.